Hi, I'm Kenya Burnett, the Director of HIV Legal Services for Legal Counsel for Health Justice. Thank you for joining us on this Giving Tuesday, a global movement encouraging all of us to engage and stand with our communities. For more than 30 years, Legal Counsel has partnered with Chicago hospitals, health systems, and community providers to provide free legal aid to people facing barriers to health care. Our work started in 1987 with attorneys representing people living with HIV, facing prejudice and barriers to health care, employment, and housing. Since then, we've expanded our services to children with chronic physical and mental health conditions, people experiencing homelessness, adults living with severe mental illness, and other adults. There has always been a profound scarcity of free legal aid in the communities with the greatest need. And with the pandemic, this resource has become even scarcer. Stark inequities rooted in centuries of systemic racism deny health and wellness to many. That is why each year, 2,400 people receive free assistance from legal counsel in accessing affordable health care, food assistance, housing support, special education, and more. The communities we serve continue to face deep rooted challenges that have only been exacerbated by the pandemic. Never before has there been a greater need for health justice and health equity. Yet, despite centuries of being historically disenfranchised, communities on the South and West sides continue to fight for change and to build the power of resonance to impact the decisions that directly affect their lives. Legal Counsel is listening. Today, we're very excited to share with you a closer look at the work spearheaded by the Southside communities and our expansion of services to Chicago's far South Side in our new partnership with the Community and Christian Community Health Center.
Hi, everyone. I'm Ben Handy, Legal Counsel's community organizer, and I'm speaking to you today from our partner site, Christian Community Health Center, where we are thrilled to embark on a new initiative in response to the community's call for health justice and to collaborate and build greater trust with our communities. Joining me today is Melody Chase.
Long before COVID 19 pushed health disparities into headlines, Black and Brown communities have faced extreme inequities in access to wellness and health care. For decades, countless studies have demonstrated the aftermath of these inequities. For instance, Black Chicagoans die an average of 9 years earlier than other Chicagoans, and 19% of Latinx Chicagoans have no health insurance, which is 6 times higher than white Chicagoans. These numbers just barely scratch the surface.
For too long, the legal aid sector has paid only minimal lip service to community outreach, rather than sharing legal power in authentic ways. This collaboration challenges that norm and is fueled by the understanding that communities are the experts in their own experiences and needs. Christian Community Health Center shares our belief that engaging intensively with Black and Latinx communities on Chicago's West and South sides is critical to combating health inequalities, community disinvestment, and institutional racism. We recognize that we cannot dismantle discriminatory systems unless we include communities in each aspect of our work, from program design to evaluation. Southside residents and leaders have long been poised to take collective action and to move their communities forward, and we are ready to join forces.
When combined with the lived experience and voices of people impacted by health inequities, legal counsel expertise in navigating complex legal systems will inspire innovative and sustainable change. The community members themselves will active partners in the building and implementation of this program. Together with the legal counsel, we will listen to their wants and concerns regarding health care and other support services and adapt our programs so that they are driven by and responsive to community input and feedback.
This May, we began building a network of 450 healthcare providers and community organizations to assess the needs and resources available within their communities. Along with engaging with the community to identify needs, our staff will work alongside medical and social service providers at Christian Community Health Center and meet with patients in the same building where they receive care. Community members will also receive advocacy training, leadership support, and skill building activities so that they can receive the tools they need to manage their health and be their own advocates. We hope to use what we learn here through this project to bring this community-driven model to the rest of our partnerships across the city of Chicago.
Legal Counsel is proud of how we engage the community in our services so that everyone has a voice and a place at the table. Each year, our legal aid provides us insight on the widespread issues our clients face. This year alone, we achieved some momentous victories in our policy advocacy. We succeeded in pushing Illinois to end criminal penalties in HIV exposure, ensuring people living with HIV are no longer unfairly targeted or prosecuted. We also succeeded in ensuring immigrant families in Illinois no longer have to avoid public benefits like Medicaid out of fear of risking their immigration status. The voices of the community should play a critical part in informing policy and systemic change. Through this partnership, we will work with the community stakeholders to identify an advocacy initiative addressing health-harming barriers to health identified by the community. Already, Christian Community Health Center clients have expressed that their major health concerns include issues like the prevalence of chronic disease, inadequate access to mental health, food deserts, and barriers to maternal and child health care. This direct and open dialogue with the community will guide the policy changes we pursue in order to reduce community-identified barriers and increase opportunities. We are very excited to continue working in and with communities to build partnerships. Legal Counsel is hopeful that this will build momentum in the health justice movement. However, we cannot sustain this vital work without the support of our donors. We are embarking on an end-of-year campaign aimed at ensuring communities have the resources they need. As we approach an unpredictable new year, we ask you to take action by spreading the word about Legal Counsel to your friends and neighbors, or by donating directly to the #HealthJusticeNow campaign at legalcounsel.org/justicenow. Illinoisans deserve health justice now, and we need you with us to keep fighting during and beyond COVID-19.